Hi there, I'm Dr. Martin Benfield. I'm a GP trainer, and this video is about how to write a clinical case review in the GP ePortfolio. So we're going to look at what is clinical case review. We're going to look at some principles behind it. We're going to look at aims, what's the reason for doing them, and we're going to look at the section brief description and capabilities, where you describe what happened at the time, and then the section for patient-based learning, the reflection and learning needs, where you work out how am I going to be a better doctor next time, how am I going to pass the exams. So clinical case review is about where you have seen one patient. So it's your description of a case that you saw. Most other things, if you're going to write up as a learning log, would be under supporting documentation. So if you've been to a teaching session, or maybe you've been to a clinic and seen a consultant consult with one or more patients and you want to summarise what you saw, that would be supporting documentation. So under the clinical case reviews, I feel there are two main aims. So the first aim is to act as a patient-based learning tool for you to have a chance to think, what did I do? Why did I do it? What do I need to learn or do differently next time so I could be a better doctor? If this was an AKT exam, what do I need to do to be able to pass this exam? The second thing is it provides your main evidence for your ESR, so your Educational Supervisors Report meeting. Before you have the meeting, you have to do your self-rating, where for each capability you select for most, not the November ESR, not your first one, but for most ESRs, if you're full-time, you'll need to select 3 bits of evidence for each capability, and they will usually be clinical case reviews. So the principles behind them are that we want them to be efficient. We want them to be efficient. We don't want you spending hours and hours doing these things. If you had, say, 2 hours of your time outside of work each week to do some learning, we don't want you spending 2 hours doing clinical case reviews. Rather, you spend, say, 30 minutes doing an efficient clinical case review and an hour and a half being able to do learning to be able to pass your exam. We want to know what you actually did. So this is not a debrief. It is not a rewriting of the case notes. This is for you to describe what happened in enough detail so the reader can understand it, and just as importantly, why did you do what you did? What were you thinking at the time of the case? So while you were seeing the patient, what did that bit of data mean? What did the fact they've got no family history mean? What did that exam finding mean? What did that test result mean? Why did you do that treatment plan? Why did you give that safety net? So we want to know what you were thinking at the time. Always write it in the first person. So I did this, I did that, or someone else did it. Now, there's no we. Either you did it, or your consultant or supervisor gave you advice to do something, or the radiologist advised. So make sure it's clear, what did you do, what were you thinking? Now, the main sections are the brief description and the capabilities. If you're not sure what I mean by the capabilities, or you can't remember what they all are, stop the video now and have a look at them. Google the RCGP capability descriptors and have a look at each of them. So they're the things like data gathering and interpretation, making a diagnosis, clinical management, holistic care. Have a look at each of those and have a look at the descriptors. What sort of things are they talking about for you to write under the capability in the clinical case review? Now, when you're writing the case, you don't have to write everything. You can select up to 3 capabilities, and I would suggest always using 3 capabilities if you can, because that then means that one clinical case review could be used in 3 capabilities when you do your ESR self-rating. So it maximises the evidence you've got available to use. So always try and use 3. I would advise making the brief description very brief. So 2 reasons for that. The first is that if you write everything under the brief description and then write, so let's say under communication skills, this case showed good communication skills. If I was a member of the panel from the deanery looking at your ePortfolio in June, if I see that, I've got to then go into all this bulk of text to see if I can work out where amongst all of this is communication skills. There's a chance I might miss it and might say, actually, that wasn't very good evidence. So, but if all of the information about good communication skills is under communication skills, I'm not going to miss it. So it makes what your evidence you give as your evidence more reliable. The other thing is, any information that you give which isn't related to a capability will never get used in your ePortfolio for your ESR. So it's effectively wasted. So the more you write the brief description, the more risk that you're wasting your own time. If you put it under the capability and it's related to that capability, it's going to be used in your ESR. So I would suggest writing the brief description as, what did you know before you saw the patient? So something like, I saw a lady, a female in her 60s in ED who presented with signs of a stroke. And then under the capabilities, you write in chronological order so the reader can understand it, what happened next. So you might have data gathering interpretation where you describe the symptoms and what they meant to you. You might then have examination findings because you described the examination and what findings you had and what was abnormal, what did that mean, and then clinical management, what you did next. So something like that would be a very typical clinical case review. Now, you might, remember we said it doesn't have to be everything about the case. So you might want to write about how you helped with the discharge planning for a patient. So that would be able to use things like holistic care, community orientation, working with colleagues, something like that. So you might write under brief description, a female in her 60s was admitted due to a stroke, was on the ward for a week, and I was involved in the discharge planning. And then under holistic care, you might write about the home situation you found out, about how you've liaised with the daughter about all the things that were needed. You may have, under working with colleagues, you can describe how you worked with district nurse or social worker to put in place care. You might put community orientation where you describe the community services that needed to be involved, how you set up a follow-up, how you notified the GP of what was going to be happening next. So in that case, you didn't need to write all about the symptoms she had. You didn't need to write any symptoms potentially. Didn't have to write about anything about the management plan or tests. It was because the case was just about how you got the patient out of hospital. All right, so that's the brief description. Try and keep it very brief if you can, and then the capabilities. So before you start writing the case, decide what capabilities am I going to use, and then write the bit of the case which corresponds to those capabilities. And then the brief description can be used to fill in any gaps potentially. So remember, the reader still needs to understand it. So although you want to be efficient and only write what's relevant to the capabilities, I wasn't there. So I need to know enough information to be able to understand the case as well. All right. Now, then you move on to the reflection section. So this is the important bit for your learning. So don't describe any new clinical information under the reflection section. This section is for where you now thinking about the case. Maybe it was last week, maybe it was yesterday. Now thinking about the case, what did I think about my performance? What could I have done differently? And the learning needs can be a specific learning needs for now it's triggering patient-based learning. So when you thought about the case, what bit could I learn? Try and make it specific. So something like maybe the patient had vertigo and you write, I'm going to read up about different ways that vertigo can present. Or we gave IM cyclizine for this patient, discharged them. I'm going to read up more information about treatments for benign positional vertigo. So try and make it specific and related to the case. Now, when you're writing the reflection, I tend to think of them as two different ways. Either they're clinical based or they're kind of emotional based. So if it's emotional based reflection, how did you feel in the case? Why did you feel like that? You felt frustrated, you were very excited, you were worried. What is it? What was your emotions? Maybe something didn't work well with the team. So you could write kind of an emotional or functional type reflection there. The other type would be clinical, and most of them are probably going to be clinical. And I think about those in 4 different ways. So first one would be when you were seeing the patient, did you look something up at the time? So did you go to the trust guidelines? Did you go to the BNF? Was there something you didn't know that you needed to look up that then helped you with the case? So under the reflection, you can write this. When I was seeing the patient, I realised that I didn't know about these side effects or this monitoring, and I wrote these things up. So this is something that you didn't know before seeing the patient, and now you know them, and you want to write them down to make sure that you remember them next time you see a patient in the same situation. So did you learn anything yourself? Did you do yourself any teaching? Second one would be, did your supervisor give you any advice? You're seeing the case, you went to the supervisor, this is what's happened, they gave you some good advice, maybe another test you hadn't done, or a treatment that might be different, or diagnosis you thought that you hadn't considered. Write that in a reflection. This is what my supervisor advised. Next time I see a patient, I will make sure I consider those options as well. Third would be, you're writing the case up now, when you're doing the brief description, the capabilities, and it's occurred to you, actually, I should have done that. So maybe something might spontaneously come to you now after you've seen the case. Maybe you thought, actually, an underactive thyroid could cause some of these symptoms. I should have done TFTs with that case. So you could write about how, now reflecting the case, I could have done this, and because of that, and this might have changed. So you can write about how this might have changed if you'd done this. So something spontaneously thought about now. Now, if none of those 3 have come up, then the 4th one is a way to do patient-based learning that is the main way for you to learn for the exams. And this would be to name your learning need, and then do your learning need, and then in the reflection write about it. So rather than doing a reflection, doing a learning need, and then saving and sharing the clinical case review, you actually do the learning need. You learn about presentations of vertigo, and then under the reflection you say, having learnt about the presentations of vertigo, if I saw a similar patient again, I would make sure I ask about these symptoms, do these tests, do this examination, consider this treatment. So whatever you've learned under your learning needs, you can put that in the reflection. Okay, and I feel that's a really good patient-based learning method. If you can expand that to other situations, not necessarily all the ones you do clinical case reviews for, but wherever you can do learning with a patient in your mind, you're much more likely to remember that in a year's time when you actually go to take the AKT than if you just read some guidelines. So try and aim to do a lot of patient-based learning if you can. Okay, I hope that all makes sense, and make sure you get these learning logs done, these clinical case reviews. Don't save 10 and then dump them all on the clinical supervisor in one go. Write them, save them, have a think about it by all means, but the next day or a couple of days later, check it through and send it on. Don't just stew on them forever. There's more efficient things to do with your time. Okay, thank you.